Welcome to this week's In Focus on Whitewater Community Television's WGTV Channel 11. I'm Eric Marsh. Thank you very much for joining me on this week's In Focus program, which is in some ways, hopefully you saw last week's show, and I think we're almost 7 years into this, and I haven't done this very often, where I take one show and kind of take something that someone said and build on it. But I wanted to do that because last week I had a chance to speak with Jackie Scott and Becky Jewison from Every Child Can Read. One of the questions that I happened to ask them near the end of the program was if they had some resources and some information that they could pass along to some parents. And they indicated that that really wasn't what they did. They suggested, if you watch the show, that's more of the work in some ways of the Early Childhood Coalition. So I reached out to the people that I knew were kind of working at the Early Childhood Coalition for Wayne County Kids. Has been part of Forward Wayne County since about 2013 or so. Nancy Green, Pat Heiny were nice enough to join me, and they are joining me. And yes, I know that they are together. They are closer than 6 feet. They're not masked up. But I think I've known these ladies long enough to know that they've probably kind of formed their own little bond here. So they're like a little family amongst themselves. So I think they're probably comfortable together.
We wore our masks in.
Okay.
We wore them out. So we're good. And we're vaccinated.
There you go. Ladies, it's good to see you. I obviously haven't seen you all a lot over the last year plus. So thank you for taking the time and joining me. I really do appreciate it.
Well, thank you. I decided as I was thinking about this, I didn't know if we were a prequel to last week or a sequel, but it doesn't matter. We'll talk a little bit about what they talked about that we can expand on, right. But we'll talk a little bit about a prequel as well, some leading up to that. I want to start with just telling folks what the coalition is and its purpose. The coalition is not Nancy, it is not Pat, it is 300 partners who have something to do with early childhood. They are businesses who care about childcare. There are preschool teachers, there are preschool providers, there are childcare providers. All in all, anybody who cares and works with little children belong to, and we try to get their name and address and email, they belong to the coalition and they are considered partners. They are the ones who do the work. The work we are trying to do is to ensure that every child, even prenatal through 5, has all of the opportunities, experiences, and developmental opportunities to come to kindergarten ready to learn. That means socially, physically, emotionally, and intellectually, having had those experiences in 0 to 5 that allow them to enter kindergarten ready to learn and take off. It doesn't mean that that period of time, little kids need to go to pre-kindergarten. There are very developmentally appropriate things they can do during that time. So the coalition's purpose is to make providers aware that they are working toward a bigger vision, not just providing childcare, although that's important. They are doing it in a way that allows kids to develop and go to kindergarten. So the whole idea of a coalition is to have a vision that all partners adopt as part of their own vision. Now, Every Child Can Read is a very valuable part. They buy the books that we distribute in a lot of places. But their purpose is literacy, but they think about it in context of the big picture, as they mentioned last week, in helping kids get ready for kindergarten. So that's the purpose of a coalition. And Nancy is our statistician, so she knows all of the data points about why it's even important that we have this coalition.
Well, absolutely. And one of the things that's truly important is that we want to make sure that at every point along the way that we have kids who are able to perform and to be a part of where they are in the continuum of their education. Unfortunately, we have data from the state that tells us we have some serious issues in Wayne County. And being number one in basketball or football or any of the sports is really great. However, in the state of Indiana, Wayne County children in the 0 to 5 category, they're number one in the percentage of children born in and living in poverty. And we have 49.8% of our children 0 to 5 being born in and living in poverty. Now, what that means is, and that's about 2,500 kids. What that means is
Shockingly high number for this community.
Exactly. Yes.
well, it makes us number one in the state. So think about all in percentage wise. So it's not a great statistic, but one of the important things to understand is that every one of those children needs intervention in their lives in some way as they're moving up to being able to get to school. And when almost 50% of your children are in a circumstance where they're not as exposed to the kinds of things Pat was just talking about in terms of being able, getting to the doctor, getting to be assessed, having people to understand that they may not see as well as some of the other kids because they need glasses or whatever. These are things that happen and that people aren't taking care of, and that's going to impact these children from the day they go to school. And it depends on what kinds of interventions happen once they get in school. And there are many opportunities where this doesn't happen. We know by being told by teachers as well as our friends that at some of the other organizations that many of our children come into first grade, kindergarten and first grade, not even potty trained. So we have huge issues, and all of these things go back from the time they're born. So we're all working together in the coalition to make sure that we touch as many of these families as possible, as early as possible.
Some other interesting statistics that have been exacerbated by the pandemic. Interestingly enough, we're in a state that is number 2 to Kentucky for child abuse. We're the second county in terms of percentages and issues and in our state. And the challenge has been in this past year that the DCS people, the Department of Child Services, tell us that they haven't been able to identify as many kids because kids haven't been in school. And teachers and school personnel are some of the very best resource for identifying kids that need services. What we hope for as a coalition is to encourage parents to self-identify some of the challenges that this has. Interesting research, Eric. This pandemic, people have looked at the impact of trauma, and poverty is a trauma on kids. Now, we've always been interested, and Butler University's Dr. Lori Desatales has done a lot of work on how to mitigate trauma within especially young children. But the interesting research that came out of Heckman's report. Now, James Heckman, I love research. I'm kind of a research guru. I'll have to tell you about my previous life. But James Heckman was a laureate in economics at the University of Chicago. He did a landmark study. He studied 25 years ago kids who went to Perry preschool. It was a kind of a Head Start preschool. And he followed those kids, and he followed their economic prowess, he followed their academic. And what he discovered is that when kids had a good preschool experience, now they started school ahead of where they might have been, but that continued. They were continuing to be even ahead of the game as they went through the continuum that Nancy talked about. Because if folks listened last week and they heard that 90% of the brain is developed before age 5. So unless those synapses are connecting before age 5, I mean, Nancy never starts a conversation unless she says, did you know that 90% of their brain is developed before age 5? What are you doing to develop their brain?
But you also have to remember that brain development is going on in the womb, and that sounds and things that happen around that mother before birth, many things the child hears and it registers, and they understand voices, and because they've heard them. And some children in situations that they're born into where it's an abusive situation between the parents, they already know those voices and they're fearful. And that's why in many cases babies are upset as they are. They have a hard time because they're aware of what's going on.
So the point is, and the coalition's work is all about making sure everybody knows that everybody has a role in helping a child develop. And I probably ought to be a little specific about the work of the coalition, because it's not just a bunch of us sitting around saying, wouldn't it be nice if kids all had good experiences? Every year since 2017, we have had kind of a state of the child conference, summit, whatever. And some of our partners, usually about 90 to 100 of our partners, and not always the same because they can never ever get there. We feed them lunch, and so more of them come.
We think food is a good neutralizing situation.
Oh, listen, it brings people out.
It certainly does, and there's no such thing as a free lunch. So
we put them to work.
They think through their experiences, and the question we asked the last time, what 4 areas could coalition partners work together to be able to move the needle so that more kids are prepared to go to kindergarten and be successful? A really scary statistic, Eric, a couple of 3 years ago, they said that about 9% of kids who went to kindergarten in Wayne County had to repeat because they weren't ready. And we'll talk a little bit, because I know in your meeting or your session with Jackie and Becky last week, they talked about what parents can do to help kids get ready. We got lots of resources for that. But I want to share the 4 areas of work that the coalition said very important to help kids be ready. One of them is to identify and intervene early. In other words, and this is really important, Eric, the state of Indiana has said to every public school system, any child age 3, the day they turn 3, can be assessed by a public school system. And if there is a special need, like they can't hear very well, or they can't see very well, or they need speech help, all of those things can be addressed in the 3 to 5 before they get to kindergarten and they're ready to go. So if your child turns their head when you're talking, not that they're ignoring you, you know, sometimes my grandson ignores me, he turns his head, but that's not what we're talking about. If you're talking and you know a child kind of goes like that to try to hear you, or if their eyes don't track, or there are speech worries that you have about them, or sometimes you think maybe that behavior isn't the way kids ought to be, call your school system, because they can assess and intervene early. The earlier we get kids assessed, the better they are. Now, at the hospital, there is an introduction to a program called First Steps. And Eric, you'll have that on the screen here for folks. If you have a child who's just born, not yet 3, First Steps can do those intervention identification. So we have 2 areas there where people have a chance to have their kid kind of looked at.
And this is not an expense to the parents.
All of this is free.
Free.
free. And if there's a challenge, the services are free. We have speech pathologists. That is, however, a commercial. Schools can never get enough speech pathologists. So that's a critical employment need.
But these are services that the family can use in the community to improve the life of the child. So it's very important that parents take their children and have them assessed, and gives them a better chance to have a good start when they go to school.
The second area that the coalition thought was really important to get partners working together was that, and they identified it in this way: kids are total human beings. We're not just talking about intellectual development, we're talking about the comprehensive approach to child development, and that every organization, every entity can have a part. On that work group, we had faith communities, because all churches and faith communities have some kind of youth education. Frequently they have nurseries. So frequently they need to know that they're part of this development as well. They will have specific things they want to do. But then we have organizations that enhance the experience of kids. Cope and Hayes both have programs that get kids in nature, that really enhance their opportunities. The Symphony and the Art Museum, they all have. RAM has the Visit, you know, that program every year that introduces the culture of a country, and preschools can go, families can go. It's a really powerful experience. So enhance the lives and experiences of kids. Kids read better when the word they see is connected to an idea they've had. So if they're talking about taking a hike, what's a hike? Well, at Cope or Hayes, they've taken a hike. So they make the concept contact and connection in their brain. So that's all very important that they do. The other piece of that we think is really important are other organizations that help parents. That's part of the comprehensive. Birth to 5. And I'm sure you've had Birth to 5 on. They provide an unbelievable service of parenting education and play groups, and they do that across the county. Communities in schools meet the basic needs of kids, and that includes the kids who are in preschool. And so we have a community-wide effort focused on little children. And the key as a coalition is to get them to talk about what they do in the idea and context that you're helping these kids develop, not just meeting a need at this particular time or meeting your organization's need, but wow, I'm a partner in helping little kids develop and get ready to be successful in kindergarten. Then the third, can I just go on?
Oh, listen. This is the easiest interview I've done in a long time. I like this.
Give me a microphone. That's all I need. The third area is to enhance childcare. We need more childcare facilities. And this is a really tough one right now because childcare organizations and facilities and providers have really been hit hard with the COVID pandemic. Their kids bring in the pandemic. They can't keep staff because of that. People weren't working. And which comes first for a full employment after this pandemic? Getting a job or making sure you have childcare so you can take your kids. When kids were not in school, either hybrid or whatever, virtual, somebody had to take care of the kids and childcare. So childcare is tough. So that right now is kind of a work in progress.
And we know that childcare in Wayne County, a lot of it has to do with friends, neighbors, and grandparents and cousins doing the childcare because of the resources that are available to people. So if they have a job, they're looking but they want someone who can take care of their child. Obviously, the neighbors and the friends and the relatives are the ones that are doing it. But they need help too, because if they're going to take over working with these children while the parents are at work, they need to understand there are resources available to them as well, so that they can be working with the children.
So before the pandemic, Morrison Reeves Library, which is a great resource, and we'll talk a little more about that when we answer the question that you raised last week about resources for parents. Morrison Reeves Library has a great preschool division, and they have a lot of good things going on right now during the pandemic. But prior to the pandemic, we had arranged for a resource fair for childcare providers. We were going to gather all the organizations and all the materials, and they were going to let us use the Bard room and have things set up kind of from opening to closing. And so we're still going to do that, because I talked with Paris Pegg and a couple of others at Morrison Reeves, and they said, well, when we're ready to open fully, we'll be happy to do that.
But for parents who have small children, they can go to the library with their child, and that whole room for children and youth that's right there to the right as you go into the library has all kinds of things. There are toys you can take home, and dolls and books and all sorts of resources in that room. And they welcome you to bring your children. They can play there, they can read there. But it's a place where you don't have to worry about things being okay. Stay with your kids. You can get a book and read. And it's important that people know that.
And while we're talking about that resource, we're jumping around a little bit, Eric, but all of the county libraries have resources for young children.
Yes.
So even if you are not in Richmond, can take advantage of Morrison Reeves Centerville, Hagerstown. Cambridge City has a great library, as does Dublin.
Yes.
And
even during the pandemic, some of them were doing reading on Facebook.
Absolutely.
Yes.
And Morrison Reeves still has these kits that come out every week that are unbelievable.
Yes.
I picked one up once just because a couple of kids from my Sunday school class were showing me what they were doing. They were great fun. They were really creative and innovative. But along with childcare, one of the things that we're trying to do is, if parents need childcare, how do they find out about it?
Right.
You will have to post online and with your program, the chances and services for youth is the resource and referral service that the state provides. So if you need childcare, you call them up and they will give you a list. And they will tell you if it's licensed or registered, because there are a variety of kinds of registration. They will also tell you if they are high quality, which means they're on the paths to quality. We can talk a little bit about paths to quality later, Eric, or we can do that right now.
Why don't you do that right now? Because the term high quality childcare has come up a couple of different times. And what is the definition of that? How is that defined? And before you answer that, you're watching In Focus on Whitewater Community Television's WGTV Channel 11. We're speaking with Pat Heiny and Nancy Green from the Early Childhood Coalition for Wayne County Kids. Go.
The Paths to Quality is the state ranking system so that you will know consistently across the system if a child care provider has a level 3, you will know what they had to do to get it. So level 1 is basically safety, and it's kind of the physical stuff. You add more to the safety and training in level 2. Level 3 and level 4 are the highest of the quality. That means they have curriculum and centers that focus on STEM and music and art and literacy and mathematical reasoning, all not pre-kindergarten as we were talking about, but to give the kids the exploration for those areas. Teachers have certain credentials. They have CDAs, which are Community Development Associates, and they of course have to have CPR and all of that kind of background. When a childcare or a preschool is level of 3 or 4, they consistently have to meet those standards every year. The level of requirement for 4 is that a teacher has an actual bachelor's degree and not some of the others. So it moves up incrementally. The cool news is if your preschool is a level 3 or 4, they qualify for state funding for On My Way to Pre-K. We happen to have 4 of those in this county, all right here. One is Oak Park Learning Academy, Star Elementary, Vale Elementary, and Northeastern Preschool. Those 4 are level 3 in Paths to Quality, and they qualify for On My Way to Pre-K. Now, if you
Which does what for them?
I'm going to tell you that.
Okay.
On My Way to Pre-K is state and federal funding with a bit of local match so that kids from homes, and I'm not going to give, I think it's 200% of the poverty level, that the parent applies, the parent has to demonstrate they are either working or going to school, but that can be a variety of educational. If a parent would like to get a child enrolled in those preschools, they can call those schools, and there is a state person, Haley Reese is her name, and they will send, I will give you that, Eric, so you can put that on the screen when you
Marvelous.
put all of the phone numbers on. She is our local liaison, and she helps people walk through the process of getting registered for On My Way to Pre-K, which means that their pre-K experience is longer during the day. It's not just a 3-hour, it's every day of the week. It is a very valuable resource and will be for this county. Oak Park and Northeastern have been eligible. Star and Vale just became eligible through one of the grants. So childcare, we kind of leaped over to preschool, but getting kids into quality childcare is another part of our coalition work, and providing resources for childcare providers as well. So it's a double edge.
And we try to make sure, as we're looking at planning meetings and trainings and so forth, that we take care of getting those folks into programs and providing resources for them, because it's important that they know that they're cared about in terms of being prepared to do the job that they're trying to do with kids.
And right now, after the relief funding, there is money to do workforce training for early childhood. That's still not totally defined. And if I speak about it, I would misspeak. So I'm not, but for childcare providers and preschool workers, there will be some help coming down the pike to get the degrees, get the stuff they want to do. And our 4th area is true kindergarten readiness. And that is getting more kids into preschool and getting more parents thinking about what they can do to help their child be kindergarten ready. We have some resources that you will see on your screen, and the Early Childhood Coalition can make these available. They are,
first of all, this is expectations for kindergarten for parents, and we have it in both English and in Spanish. So we're trying to make sure that all the folks around have the opportunity to find this information.
and aren't they at the libraries
Yes,
now?
yes.
So if you go to the library, you can ask for that. But one of the questions that Eric asked Jackie and Becky last week was exactly what could parents do to help their kids get ready? You have those things, and some of them are a little more academically framed, but what kindergarten teachers tell us is that the social, emotional, and physical habits are more important, because and listen to this list. This is a list that kindergarten teachers from around the country published. And so we're going to give to every incoming kindergarten. We'll talk about that bag in a minute. But listen to this. You take some of these things for granted. So for example, bathroom skills. Kindergarten teachers want kids to know how to flush the toilet and not have to take your pants all the way down just to use the urinal. You gotta know how to do that. How to wipe yourself, because kindergarten teachers have enough to do without making sure that they have to go take care of bathroom etiquette, shutting and locking the bathroom door, and washing your hands. Now, I'm thinking that after the pandemic, everybody knows to wash their hands, but we'll see about that. And teachers keep reminding. But a couple of other things they can work on. How do you hold a pencil? In the resource bag, we're going to give every kindergarten, incoming kindergarten at one of their signups this spring will be a pencil that's about that big. Kids, well, arthritic old ladies and little kids like big pencils and pens. So there'll be a big pencil and big crayons. But how do you hold a pencil? How do you hold crayons? Kindergarten teachers don't need to teach that when kids come to school. How do you hold scissors? That's really important, and that's something all parents can do with kids. Here's something that kindergarten teachers said sometimes kids don't know: their first and last name. Well, I'm Sonny, I'm Buddy. Oh, Sonny and Buddy. You know, they need to be able to share that information. Their parents' first and last name. How to keep their hands to themselves, the social habits, how to sit in a chair, how to listen to a book, and Jackie and Becky mentioned some of those. How to zip. Now, they don't have to know how to tie their shoes, because developmentally, you'll learn to tie your shoes when you're in kindergarten, you know, the two bunny ear, never mind. But if you know how to zip and
Snaps,
exactly, Velcro, you know, that's why they inherited or developed Velcro, right? So it's those kind of everyday personal, social, emotional, and physical habits that parents can help their kids do that we don't think about.
And one of the important trainings that parents need to have with their children is that we understand from preschool, kindergarten, and early first and second grade teachers is that children need to be potty trained before they come to school. And there is a deficit in that training that we have in our area. So that's another area that we need to work on.
So when you ask what kindergarten readiness looks like, some kids may know their numbers and colors, but that in terms of brain development is a little more appropriate kind of in kindergarten. But being ready to learn by being able to sit, listen to a book, knowing some words. The key to poverty that, and Eric, I'm going to try to find, I tried to find the statistic and couldn't. Kids who grow up in middle class homes hear exponentially more vocabulary words than kids who live in poverty. And just hearing words on TV or on a device, not the same as hearing a human being utter those words and you physically interacting with those words. And as we were talking about the experiences of music and art, knowing the context in which those words happen in real life, it's important as the external environment that we were talking about earlier. So not just reading with kids and not just helping them develop these habits, but you've probably seen, we have posters all around and we have bookmarks in both English and Spanish that say, parents, you don't have to be teachers, but here's what you need to do. If every day you read with a child, if you sang with a child, you know, I know Becky and Jackie talked about nursery rhymes.
yes.
That's one, and how do kids remember anything? You sing with them. You just, whatever kinds of songs you can come up with, singing, playing with them, modeling the way. So using the vocabulary. So all of those things, and when Jackie and Becky mentioned last week, just kind of the natural things you do when you sit with a child, we talk a lot. And one of the videos that really useful is how to do, and I'm not going to have the official word, but it's how to have a dialogue with a child as you're reading a book. Oh, what do you see in that picture? What color is that? Not just reading the words. And as a matter of fact, you don't even have to know the words. You don't even have to read to them if you can just point out the pictures and have a conversation with them. So kindergarten readiness is including all of those things that we've been talking about. You're going to get your kid ready for kindergarten. Now going to
You'll have fun doing it too.
Oh, I'm sure. You're watching In Focus on Whitewater Community Television's WGTV Channel 11. We are speaking with Nancy Green, Pat Heiny, Early Childhood Coalition for Wayne County Kids. You all have been doing this since, I think we said 2013 at the beginning. I know one of the things that some people, not everybody, but some people are wondering is the handouts, all of the printing. How are you all doing this? Everything that you're talking about takes
money.
How is that? How is some of this being funded? How much of this are parents needing to put out? Now, you've said some of this is being done in public schools. Public schools, obviously, they're not charging them. But when you start talking about high quality childcare and start talking about the poverty level here in Wayne County, because you all were running those numbers for us, how are those things correlating and how are we making this work? And from 2013 to now, are we seeing things improve?
That's about 85 questions.
Yes, it is. But see, I didn't ask any in the first 36 minutes of the conversation, so I got them all in.
Well, Nancy needs to tell you about how this whole thing started, because that's part of how we got some money.
One of in 2013 was the 50th anniversary year for Ivy Tech Community College across the state of Indiana. And the president of Ivy Tech said that he would like to find out what's going on in each of the areas in terms of what are the impediments to students getting their degree. Mm-hmm. So at Ivy Tech here, I was working there in marketing. And so student government did a survey of our students wanting to know why they didn't complete. And there were three things: transportation, connectivity, right, and childcare. So when we saw those results from the survey that student government did of all the students, then we said, well, we need to do some things about this. And we brought together a group of community leaders. Pat was there. She was representing the mayor in those days.
Yeah, and the school board.
And the school board. And we had the foundation was there, the Wayne County Foundation. We had the principals from the superintendents from all our school systems. We had a number of other folks across Wayne County that were part of a group that started talking about how we were going to go about trying to make some changes and make it possible for students to complete college.
And what was interesting in those conversations, people started saying, you can't get ready to finish college when you start college. And so, especially with the educators, we started looking back. Maybe we ought to look at high school. Well, that's not early enough. Maybe we ought to look at middle school. Well, that's not quite early enough because kids already have habits formed. Third grade academy had already started and it was beginning to show results. And we said, but third grade is too late. You got to go earlier. So sitting around the table at that time, Nancy ran into this woman, Johanna Strother from Early Learning Indiana. And she said, you know, this committee is really a coalition. We said, oh, really? We just thought we were a task group, kind of a work group, kind of talking about these things. Yeah. And she said, no, you're a coalition. So she got us $25,000 to build the coalition. So we bought lunches and we paid for some of the materials. One of the other things Early Learning Indiana has done as a state entity, they aren't a government agency. They had run childcare centers, and then they started looking at a bigger picture, and Lily gave them money. So they said, here's a grant opportunity. Would you be interested? So I wrote a couple grants, and we were able to apply to the FSSA, which is Family and Social Services Administration, the Office of Early Childhood Out of School Learning. Say that 5 times.
No.
For preschool capacity grants. And so we got almost $250,000 that Oak Park, Vail, Star, and Northeastern were able to add classrooms. And then Lily Endowment said, but there are areas of the state that don't have childcare. So we wrote a childcare desert grant that allowed Sugar Creek and the YMCA to begin their child care facility in Western Wayne schools. And then they said, but we're worried about the transition from out of school, preschool or no school, to kindergarten. So this transition is called Strong Start, and they gave us $25,000. So that's how we paid for, we have another way. And then they called us up one day and said, we'd like to do some advocacy training for early childhood people. They said, we happen to know a couple of women in Wayne County who are assertive. That's what they said.
There's a word.
Assertive. And
Shy.
thought we could organize a group of local professionals. Could you get 20? Well, we had 28 and we had to turn it off, but they paid us $25,000 to organize that. And that wasn't for the food. They paid for all the food. They paid for the training. It was excellent training. So we've had bits and pieces. Now the bits and pieces are about ready to run out. So we'll come asking people sometime, but we don't want to take so much money to run the coalition that the partners on the street don't have the funds they need. That's
been our focus all the way along, is to make sure that folks that needed resources, we worked very hard to get the resources for them.
So a couple of other things though that we need to tell people to be on the lookout for. As their child enrolls for kindergarten across the county, they're going to get a bag, bright yellow bag with some resources. They'll get a box of crayons, Crayola crayons, big pencil, a bookmark, they'll get a coloring book, they'll get a reading book, and they'll get this list of life skills checklists so that parents can kind of work with them.
And it's got the little hangers in the back, so you can carry this little backpack around.
And you know how kids love little kids. They'll put toys in it, they'll put
their stuff in.
Yeah, but the other thing, we have a committee of teachers who work at identifying children with some challenges, but also just helping parents assess. And they've put together a flyer. And that flyer is going to go in every public conveyance they can find. It's going to go in the liquor stores. It's going to go in the smoke stores. It's going in the convenience stores. It may even go in the health department van that moves around. It's a basically simple message to parents. Does your child, and go through the symptoms, kind of behavior or not picking up a pencil or can't hear, etc., then call this number. You know how flyers have numbers at the bottom you pull off and call, whether if you want to, enlist in the Army or if you want to do anything else, you do those kind of things. Well, they've decided that's the best way to approach parents. Parents who know have already looked for help. We're trying to get to folks who don't know, or who aren't in communities of people who can convince them to do things. So that's one project. Another project that came out of that transition, the Strong Start grant, last week, 45 of us had a webinar with Dr. Lori Destells, who talked about how to help kids self-regulate even though they've been through trauma. And I think you've had folks on who've talked about ACEs, adverse childhood experiences. If not, that's one that you really need, and we'll get you some resources for that. But helping kids self-regulate, very simply, helping them hum, because when you hum with the child and the child starts humming, they start calming down. You've seen about tapping, when kids are, tapping, or when kids almost meditate and some yoga stretches, helping kids move around, always keeping them moving. Instead of saying, kid, calm down, show them how to calm down. So we had preschool teachers, we had childcare providers, we had Centerstone, we had Meridian folks, we had probation folks, we had principals, we had all sorts of people, hospital folks, listening and working with Lori Destells to help learn how to help kids be calm in those kind of situations. We thought it was really important, especially after this pandemic, when kids will be coming back to school, kind of not sure what's going on in their lives and whether they have had trauma. So the coalition basically, as Nancy said, wants to provide resources for folks, but also wants to get people together to talk about what they do and how a partner can help them so they're no longer working in such silos. Too often, early childhood folks feel separated and isolated, and they need to see others they're in this with other people. But also their organization is part of a bigger whole, and not HOLE, but WHOLE, a bigger whole vision. Mm-hmm. And they need to see how they can interact with others. So the coalition in our pre-pandemic time, yes, we try to bring folks together physically, although this year we've done a couple of Zooms, and
it's worked out. It hasn't been as good as being all together in one room so that people can really work together and work on projects together.
But interaction is easier when you're in a room together.
Absolutely. And just knowing the other people in person, it's easier to call them up and ask them something. So there is the coalition in a nutshell, and there's probably more you would like to ask, Eric.
We're down to about 8 minutes. You all have made this very easy on me. Thank you very much. One of the things I want you all to talk about in our last few minutes is, and I asked this question last week, are we as a community understanding and taking this as seriously as we need to? Because in my mind, in my feeble little brain, if we don't get this piece right, I'm not sure that anything else that we do, no matter how much money we throw at housing, at infrastructure, at anything, if we don't get this piece right, we don't move forward as a community. Tell me how wrong I am in that thought process.
You're absolutely right.
Are we taking this seriously enough? No. I know that you all have your coalition, but as a
no.
Government, do we have higher education? Is this an all hands on deck to move us forward? You're telling me we're #1 in poverty. You're telling me our kids are suffering. Are we dealing with this as we need to, in your mind?
Nancy will tell you with tears in her eyes that we as a community don't care. One of the major responsibilities of early childhood coalitions across the state, and we talk about this all the time, is to generate the public will to do something about the issue. And by public will, it is exactly what you said. Everybody has to realize that what they do fits into the developmental approach that young children need. If you want a really good example of this, look to Florida.
Yes.
About 30 years ago, Lawton Childs was governor of Florida.
Yeah.
And he wanted to think about little children. So he approached a very significant, influential friend of Nancy's, David Lawrence, who was publisher of the Miami Herald at the time. And together they built the Children's Movement of Florida. Their legislature responds to the children's movement advocates and lobbyists, basically.
Right.
A primary goal for us is to get our legislature. Kindergarten is not even legislated. It is not required of anybody to go to school until they're 7 years old.
Yes, in the state of Indiana.
I'm sorry.
Yeah. And so
Really?
most
Yes.
kids do, but most kids do. But so in a number of states, On My Way to Pre-K would be a universal program for every child. And we've got to get this moving up and moving down, as you've just said. The people who care deeply and desperately and work and put their own resources there. I'm going to be real honest, an awful lot of them are women who either aren't taken seriously or don't see themselves as serious spokespeople. If you know what I mean, we've got to push that they are power.
And one of the things that is disheartening is that I have had on a number of occasions, people, adults, primarily business people, who have said, I'm really not interested in what's going on in preschool and kindergarten and the lower grades. I'm not really interested in folks until they're ready to graduate from high school and I can hire them. Well, the kinds of quality of folks that you get coming out the other end in terms of employable folks, you got a much harder time to go to get people ready for graduation and to think about work and the future and college. If the folks around them and in business organizations really aren't interested in their progress so that they'll have better employees.
So don't you, when you talk about workforce, everybody talks about soft skills, attendance, showing up on time, being able to do what the boss tells you to do. All of the executive functions that.
And everybody is saying that that's lacking. HR people that I've had a chance to talk to, they all say that that's lacking right now.
And the list we started reading to you about sitting in a chair and all of those are the beginning, the precursor to all of those. I noticed that when Becky and Jackie were talking about the Reading Academy, I got it right, that they were talking about attendance. You know, school is cool from the chamber came about because employers were saying attendance was such a huge issue. And so when we start young, talking about the importance of being there, attendance, whatever, you know, one other thing that I want to add for K-Ready and Every Child Can Read. Do you know the story of how the Reading Academy started? Suzanne Morse with the Pew Trust spoke at an educational forum a long time ago, sponsored by the foundation and the Learning Corp, which was way long time ago. She said that you want to, and at the time we were talking about building a new jail or had just built a new jail. And she said, you want to know how many beds you need in a jail? Look at your 2nd and 3rd grade reading scores, the kids who don't pass. That's how many beds you need. Well, Vic Josie and Rick Ahaus were in that audience and they said, what? We got to do something about this. And at the time, the third grade academy started because Suzanne Morse said, you don't want to build any more jail cells because you want to get kids reading. And at the time, Rick was on the school board, and we'd gone to a number of school board conferences that talked about that. So his example, and in response to your question and as a summary, what can folks do? They don't have to start reading academies, but they can support reading academies. They can be like Sugar Creek and provide childcare for their employees because they know a good employee needs childcare and they're going to take care of them in that way. So when we expand the conversation, we have to talk about how it really does impact their workforce and be real serious about that. Connect the social developmental, emotional development to executive skills and soft skills, making those connections for people because they don't do it by themselves.
And the U.S. Chamber of Commerce is very serious about this as well, and they have extensive materials available for chambers to use as they promote this in their own community. So that's another area that we need to make sure that people get information about.
So that's probably our time, Eric.
You've done very well. Did you have a stopwatch on it? Did you know? Was it a look on my face? Listen, thank you. Thank you very much for taking the time. Thank you very much for talking to me. Please trust me. This will not be the last time that I reach out to you all and ask you to either lead a conversation with some of your partners to kind of update the community on what's going on, or lead me to somebody that I need to be having a conversation with. Seriously, thank you very much.
We will. Thank you.
Pat Heiny, Early Childhood Coalition for Wayne County Kids. Look for the yellow book bag during kindergarten roundup, and we will have those resources. You saw them on the screen, and we will also make sure that they get put on social media. Before we get out of here for this week's In Focus, a couple of things to remind you of. April 22nd, Gardening Made Easy, an introduction to gardening, presented by Stephanie McCurdy at Cope Environmental Center. And April 29th, Container Gardens and Raised Beds, presented by Jonathan Ferris from Purdue Extension, Wayne County. This is through Morrison Reeves Library, mrl.info/green thumb, or call 765-966-8291. Spring flower sale for CIS Wayne County. That information is there on the screen. They're accepting orders until the 22nd. You can call 983-2263. And if you're seeking employment or training, check out easternindianaworks.org. I want to remind you that there'll be a special In Focus coming up on May 6th. That will be the State of the City with Richmond Mayor Dave Snow. Thank you very much for watching this week's In Focus on Whitewater Community Television's WGTV Channel 11. As always, I wish you well. Have a great weekend.